to another episode of Fun Facts here at the pharmacy. My name is Dr. Christopher Greider. I'm your host. The main purpose of this show is to help you guys to understand important health topics so that you can make great decisions day in and day out, whether or not a healthcare provider is there for you. So the beginning of our show always starts off with a segment called Fast Acting. The purpose of this is to try and introduce some just quick material for you guys about relevant topics that are going on so that you're up to date. There's two things that I actually want to cover with you guys today. The first topic that we want to talk about is in regards to drug abuse right now. It's a growing topic, and actually, as of March, there was a statement that was made by Donald Trump in regards to combating opioids with something called a vaccine. Now, the first thing I want to tell you guys is this is something that's actually just experimental right now. They have been testing with the FDA a way of actually administering a vaccine to fight against opioids. Now, you're asking yourself, what is opioids? What is drug abuse in general? The main thing that we're looking at is pain medication. So we're talking about things like Percocet, Tramadol, Vicodin, oxycodone. These are all perfect examples of that. If you do need a running list, you can always ask your pharmacist, or if you want to look it up, you're more than welcome to. But these are the medications that have extremely high addiction factors that can actually cause a lot of health problems. Now, there are other drugs of abuse that they have out there, such as heroin, fentanyl. These are some of the most common ones that are actually common in Northeast Ohio. The reason I bring this up to you guys is because the cost for treating people with these types of medications and illicit drug uses, it ranged to about 24.6 million people in the year of 2013. This cost the U.S. about $1 billion in the healthcare industry. So in order to help fight against that, it's important to look out for the signs and symptoms of it. We will cover in a future episode about pain medications in general and what's the best ones to use and how to go about using it and what it does. But for right now, the main thing that I want people to understand is that when you have these people that are using illicit drugs and drugs that can have the potential for abuse factors, you have to be very careful and very cautious of the signs and symptoms of what to look out for. Now, one of the big things that people don't notice is that there's a lot of pupil dilation, trouble with breathing, lack of interest, and sometimes just essentially, if you look at their arms, they may cover their arms if they're using any kind of needle-based products. So that would be used for things like heroin and fentanyl. If you start to notice these signs, or if anything goes wrong, we always have to be very careful. There are medications that are available that you don't necessarily need a prescription for at the pharmacy. One perfect example is naloxone. This is meant to help bring people out of these overdoses. Now, the main thing is when you think of overdose, a lot of people think of also just drug abusers, but this can be used for patients that are actually prescribed these medications that may have taken too much. They had a dose increase, or even if children actually get their hands on it on accident and end up swallowing or ingesting it. So to be on the safe side, always talk to your pharmacist about the importance of it. The other thing that I want to bring to your guys' attention to this month is for the month of April, actually on April 28th, it's actually our Drug Take Back Day. So it's a National Drug Take Back Day. If you have any questions or concerns, you can look it up online, or you can actually check with your local city, government, and police departments. They actually do set up a time that you can drop off all old, used, and expired medications, even if it is illegal medications, or even if it is something that can be abused, such as controlled medicines like those opioids. You can take those in if you don't need them any longer and dispose of them, and they'll take care of it. The other thing about that too is if you do have medications at home and you're unable to make it to one of these events, or you're unable to drop them off, there are certain facilities, especially police departments, that have drop-off locations. If you are unable to drop those off, you are actually more than welcome to get rid of them yourself. The main thing that they say, and you'll actually see it from an image I have for you guys right here, is that what they want you to do is they want you to mix your medications in. Don't crush them, don't break them apart, but go ahead and just throw them into something, whether it be coffee grounds, kitty litter, just something just to kind of mix it in so that A, people, if they are digging through your trash, do not see it, and B, it helps you to get rid of it safely. Put that all into a bag and dispose of it in your garbage. That's the best thing that you can possibly do. I even have some patients that come in that say that they use their coffee cans, which is a good example too. So just mix it into that stuff so that nobody has the potential to use it or abuse it. But talking about that, one of the biggest concerns that we have right now in the US is actually smoking. Now, when we're talking about abuse, smoking itself can be one of the hardest things. So to help me kind of talk about that today, I actually have one of my students with me this month. Her name is Carly. Hi, Carly. So tell us a little bit about yourself.
So I'm a fourth-year pharmacy student at Northeast Ohio Medical University, and I'll be graduating this May with my pharmacy degree.
Congratulations.
Thank you.
So to kind of help the general public understand a little bit, what can you tell us about smoking, especially here in the U.S.?
So smoking is a big problem. It's been one that we've been trying to combat for the last probably 50-some years. Looking back in the 60s when we all know that it was very prevalent, and we've noticed that it has declined over time with the help of the Surgeon General, the U.S. Surgeon General in 1982 actually said that cigarette smoking was the single most avoidable cause of death, and was a big public health concern. So since then, we've really tried to combat smoking and convince people that they should be trying to quit. But right now, it still contributes to over 480,000 deaths per year in the United States, with over $300 billion. That's either health-related causes or patients that have health problems that, aren't able to go to work because of it, and they're all attributable to their cigarette smoking. Currently in the U.S., over 40 million adults still smoke, which is around 15% of the population. Compared to the 60s, where we know it was really a big problem, that was over 40%, so it has come down some. But still, it's obviously a problem that we continue to need to fight.
Yeah, absolutely. It's like you mentioned, it's something that's easy that we can avoid that can actually have a lot of benefits later on. But since we're talking about that a little bit, one of the biggest concerns that people have is what are some of the effects that smoking has, whether it be short term or even if you've been smoking, say, 30, 40 years later down the road?
So I think the big thing people first think of when they think of smoking is lung cancer, but it can actually cause different cancers throughout the body. So you think you're inhaling a cigarette. There can be oral cancer, it can get into the stomach, gastric cancer, esophageal cancer, also things you might not think of like colorectal and breast cancer. But besides that, heart disease is a big one, leading to heart attacks and strokes. It greatly increases your risk of those. Also reduced fertility, problems with pregnancy in women that smoke while pregnant, not just affecting themselves but also the baby, even leading to things like infant mortality and birth defects. It can also cause problems with the eyes and with cataracts and degeneration that you hear about, problems with diabetes, osteoporosis. So I think people normally attribute it to lung cancer, but it can actually affect every system within the body.
Yeah, and that's a very good point to make. It's that the smoking that we essentially do, we don't realize can hit literally everything. And the three most vital organs that I always talk to people about is your brain, your heart, and your lungs. A lot of people don't realize that they all work together, and they're essentially the prime association that your body uses to kind of keep everything running. So if there's an issue, if there's ever a problem, and especially with this in regards to your lungs, I mean, it'll naturally impact your heart and then further on impact everything else. So yeah, so that's a really good point to bring up to everybody, especially when they're talking about the consequences of smoking. Now, one of the things that we always have to fight against for a lot of our patients is I have people that tell me, like, whenever they try to stop smoking, it's one of the hardest things. But I think a lot of people don't realize that smoking is just like anything else out there. When you first start, you do go through kind of like a withdrawal period. So can you kind of tell us a little bit about what that is?
Yeah, so initially, even after, a day or two after you decide that you want to quit smoking, the symptoms really start to happen, and it is a nicotine withdrawal, which nicotine is the addictive component of tobacco smoke that makes you, it activates a reward pathway, so it causes a pleasant feeling. So that's what makes it hard to stop, because you feel better when you're smoking because of the nicotine. So when you take that away, you can have symptoms that range anywhere from just irritability, frustration, anger. It can cause some anxiety, depression, just overall not feeling well, and not feeling well mentally and physically. So these things kind of happen within the first couple days, and then they get worse within the first week. But then over time, within 2 to 4 weeks, they slowly start to dissipate and go away. So that's what makes it hard to stop, because you have these feelings that you don't like, of feeling angry and irritable. And then, you know, just by smoking one more cigarette, then those maybe can go away. So that's what makes it hard to quit.
Gotcha. Yeah, so that would be something that I always like to tell people, like, especially if you have loved ones that you live with or anything like that, when you first start with something like this, it's always important to get their input and get their involvement, because they may start to notice those things that you had mentioned with the irritability and mood changes. So in order for them to feel like they're not being like shut out because of you being a different person, it's mostly just going through that.
Yep.
But I always like to tell people too, that's the main thing, is if you can stick it out through the initial period of it, it does progressively get better, like you mentioned. So perfect. Well, when we're talking about smoking, we are trying to find the easiest ways to help people quit. So in regards to quitting, there is something called smoking cessation, as they term it, but it's essentially stopping, a way to stop smoking is kind of the idea, and to pull yourself away from the cigarettes. So what are some techniques that they use to kind of help people quit smoking that maybe don't involve any kind of medicine?
I would say the biggest thing is actually counseling and what's called cognitive behavioral therapy, which is just counseling. And because it is such a mind game with yourself, when you quit smoking, you're going through this withdrawal. Like you said before, that it's a habit, so it's hard to break. It's just more of, you know, talking it out with somebody, finding ways to deal with the stress. And if you smoke when you're stressed, or you smoke to relieve stress, what's something else you can do instead of smoking? Getting yourself ready by imagining a time when you might need a cigarette or think you need a cigarette, and what can you do ahead of that to, you know, not need that cigarette. Also, just preparing for the time when a friend of yours comes up and says, do you want a cigarette? How are you going to handle that? So that counseling, the just behavioral training, really helps deal with the mental aspect of quitting. And that's half the battle of quitting smoking.
Yeah. So, yeah, that's when we're looking at the grand scheme, we want to make sure that people are seeking out the help that they need. When we're talking about that, just to kind of backpedal a little bit, what are some of the benefits when people stop smoking?
Yeah, so you can start to see benefits almost immediately, even just as simple as 20 minutes after quitting, 20 minutes after your last cigarette. Your blood pressure actually increases with nicotine, with smoking, so after 20 minutes your blood pressure starts to return to normal. If you're somebody that already has high blood pressure, is maybe taking a medication for blood pressure, it's really important that your blood pressure obviously stays at goal low, where we want it. So you start to experience that just as simple as 20 minutes after quitting. Other things that happen shortly after that, 8 hours after quitting, carbon monoxide, which is also found in cigarettes. We know that's scary. We don't want it in our house. It's in cigarettes, so it gets into our bodies. 8 hours after quitting, carbon monoxide levels go back to normal. Your risk of heart disease and strokes and heart attacks go back to normal after a year to 5 years after quitting. So it starts as simple as 20 minutes, and as you progress through the years, everything can kind of come back to normal eventually, which I think is a common misconception that, oh, I've been smoking for 40 years, my heart's never going to go back to normal. It actually can. It might take 15 years, but that's 15 years better than where you would be if you'd continued to smoke.
Yes. And that's a really good point to bring up for everybody, is that the lungs are kind of an amazing feature of our body. They do have the ability to repair themselves. It just takes time, just like anything else. So we always want people to be aware that that's kind of what we're hoping for. We want you to get back to that normal lung function. We want you to feel like there's no serious issues that are going on that prevent you from, you know, interacting with your family or going out and working out or doing something like that. We want to get you back to that normal point. So, yeah. Perfect. The one thing that I've always heard, and it's something that you could talk to your doctor about and they may bring it up, it's something called the 5 A's of smoking cessation. Now, what exactly is that? Because I know I've talked to patients about it and they brought it up to me, and I know I've talked to them, but kind of what are we looking at when we're talking about that? Yeah,
so the 5 A's are a tool that's used by mainly healthcare providers, but I think it's something we can even use on each other, friends and family that are smokers. Basically, it's just a process that you go through with somebody who is a current smoker, and assessing their willingness to quit. So the first one is ask if they're willing to quit. If somebody isn't willing to quit at this time, then that's as far as you go. If they are willing to quit, maybe it's something they've thought about, but just haven't taken any actions yet, then you progress to the next A, which is advising to quit. So you'll say, you know, is quitting something that you're willing to do? If they say yes, okay, well, now I'm going to advise you to quit because these are all the benefits that you can experience when you do quit smoking. After that, the next one is assess the readiness to quit. So is it something that they want to do right now, or is it something that, you know, is a year goal or a few years down the line? Because if it's something they want to do right now, then we can move on to the next one, which is assisting with quitting. And whether that's using medications that we'll talk about, and along with the counseling and things, you know, training your brain to not want to smoke anymore, that's all in the assist to quit. And then the last one is arranging follow-up, because we don't want to have this conversation with somebody where we've helped them get to the point where they want to quit and now they have a plan to, and we never follow up. So that's something really important for healthcare providers, but also for a friend or family member that's wanting to quit, that you continue to ask how it's going and show your support for them.
Gotcha. Yeah, and that's the main thing, is being accountable essentially for your actions and kind of following up, regardless of whatever it is, whether it be tobacco, whether it be even simple things like drinking soda. I mean, if you have that accountability, it does help out significantly to kind of keep you on track with everything. So, perfect. Now that we've kind of reached that point on some of the benefits of it, which we'll show you an image here kind of explaining some of those benefits right now. So as you can tell, it kind of breaks down what we've already talked about, which is the 20-minute breakdown all the way to the 15-year breakdown. So if you want to pause it at this particular point, you're more than welcome to kind of read through it, but it does list a lot of the things that we've already just mentioned. We're going to kind of shift over now to, you know, we have the cognitive behavioral way of trying to stop it, but for a lot of people, it's very hard to just quit off of that, or even just to cut it cold turkey. So kind of talking about that, what are some of the available treatments that we have that might be more like over the counter that you don't need a prescription for? Yeah,
I think that's another common misconception with quitting, is that you can just quit cold turkey. While it's possible, it's very, very hard. And there's a statistic that says up to 95% of people who quit cold turkey actually go back to smoking. It's not successful. So that's why we talk a lot about the counseling and the cognitive behavioral therapy and ways to, you know, train your mind not to want those cigarettes anymore. But there is some medications that are available to assist with that too. The big one that I think a lot of people hear about is nicotine replacement therapy. So this comes in gums, it comes in lozenges, patches, there's an inhaler, also a nasal spray. But basically what it is it's nicotine that kind of provides you with the nicotine so that you don't go through the withdrawal, so that you can concentrate on training your mind not to want the cigarette. So if you're not having the withdrawal symptoms, then you can focus on what else can I do in those times of stress that we talked about. And you can, you know, have something, whether it's gum and lozenges or the inhaler and nasal spray, that kind of provides that like oral, like a cigarette. So there's many different things that come along with the nicotine replacement therapy, but compared to cigarettes, it does provide nicotine, but it provides a lower amount of nicotine, and it also delivers it in a slower way. So when you initially inhale a cigarette, nicotine reaches your brain within seconds. So that's what provides that instant feeling of pleasant and reward pathway that gets activated. But with these therapies, it delivers it much slower to the brain so that you don't have those kind of highs and lows that come with cigarettes.
Gotcha. Okay. So you're kind of getting something throughout the day if necessary. Yeah, one of the big things too that a lot of people need to understand with a lot of the over-the-counter, like the nicotine replacement therapies you mentioned, there are different steps. So for each step, it's focused a little bit different. So you normally start on a higher amount depending on either how many cigarettes you're smoking, or for some of them, they actually do have you take a look at when is it that you smoke your first cigarette. But we kind of hit those to try and figure out where's the best starting point for you. So So for a lot of our patients, everybody's a little bit different. So it is a good thing to kind of talk to a pharmacist if you have any questions, because we're the ones normally there, or even your physician if you are going in to see them, to kind of talk to them about where's a good starting point. One of the big things, and especially for people that haven't been, that tried quitting at one point and then stopped and then have recently tried again, one thing that they've kind of talked about is there is the over-the-counter medicines, but there's also the prescription. It used to be very uncommon to use multiple nicotine replacement therapy type products at the same time, but now it's actually becoming a little bit more of a standard to help people out. So a combination of, say, like the patches with the gum or the patches with the lozenges helps out significantly, so that you kind of have that nicotine throughout the day, but then you're also, if times are getting hard, you have something to kind of fall back onto, so that it doesn't force you back into a cigarette smoking habit. So yeah. So kind of taking a look at that, there are some prescription-based ones. So if the nicotine replacement therapies are not working for you, what are some of the alternatives that the patients can use that might be more prescription-based? Yeah,
so there's really two medications that are used for smoking cessation that are not nicotine-based, and that's bupropion and varenicline, or Chantix, as you probably have heard it. So bupropion is actually an antidepressant medication. So what that does is it helps with the cravings for cigarettes and also with the withdrawal symptoms. So if you think nicotine is activating that reward pathway and then we take it away and we don't feel our greatest, a medication like bupropion that can kind of help level out your mood throughout the day can help with those symptoms. So this is a twice daily medication that really the only side effects are just insomnia and dry mouth. It doesn't happen with everybody, but it has been proven to really work for nicotine withdrawal and to help with the cravings for cigarettes that people that smoke have. And then Chantix works a little differently. It actually competes with nicotine throughout the brain. So by kind of blocking nicotine from binding to where it wants to bind, it prevents those highs and lows from happening, and also contributes to lessening the withdrawal symptoms that patients have. It's kind of dose difficult, I guess, to begin with, just because you have to gradually increase, but it eventually is a twice daily dosing, and that's something to definitely talk to your pharmacist or your physician about, to make sure that you know exactly how you're supposed to take it. Side effects with this one, just nausea, some insomnia, headache, but nothing too out of the ordinary. And again, this one is really proven to be effective. Yeah.
So yeah, with those types of medications, it's always, with a lot of the prescription-based ones, you do have to be somewhat titrated up. So you do have to start on a much lower dose and then gradually increase it, because we don't want anything severe to happen sometimes. These are the type of medications that, especially when you're using something that can impact the brain, we don't want to go overboard with it too quickly, especially if your body can't tolerate it right from the start. So with those in mind, the main thing that we're always looking at is with Chantix especially too, there is a starter pack and a continuation pack. So it is something really good to talk to your doctor about if you do want to start on something like this and you've tried other things and they're just not working. The starter packs are typically covered, and so are the continuing packs by most insurances, so that does help out substantially. One other thing that I've always had people ask me about too that I thought was interesting was there's something new in regards to e-cigarettes. So a lot of people, especially younger people that are in their 20s, they're starting to convert over from regular cigarettes to e-cigarettes or vaporizers is kind of the idea. So was there anything that you came across that kind of helped explain if this was of any benefit to people, or?
Yeah, so it's a very common myth that e-cigarettes are safer than regular cigarettes, which is completely not true. We don't really know what's in e-cigarettes, so it's not safe to put what we don't know into the body. There's no evidence to support that they help people quit smoking. I mean, they contain nicotine, and I know there's varying levels of nicotine within the cartridges that you can put in e-cigarettes, but there's no evidence that this helps people quit. They also contain carcinogens, which are cancer-causing compounds within the e-cigarette. These are toxic to human. They can still cause cancer, and we don't know the long-term effects as well as we do with cigarettes. And I'm sure in the coming years we'll continue to see more evidence against the use of e-cigarettes as we learn more about them.
Yeah. So at this particular moment, at least from our standpoint, we don't endorse the fact of using e-cigarettes as an alternative method. There are certain devices that are out there, especially like with the nicotine replacement therapies. There are actual like essentially inhalers, like nicotine inhalers that kind of help. Because for some people, it's more of that hand to mouth action that really is what makes it harder. They're so used to actually using the cigarettes. So
yeah, and that's where the nicotine inhaler really can work if you really need that hand to mouth comfort, I guess, that you're used to with a cigarette.
Exactly. Yep. Besides that, the other resource that you guys have that it's available that a lot of people don't know about is 1-800-QUIT-NOW. So if you actually give them a phone call, the nice thing is if you are uninsured at this particular moment, or if you're looking for just general help, they're a great resource because they can actually provide you with a lot of these nicotine replacement therapy products at low to no cost to you because they're meant to be here to help you guys out. The main thing we always want is just for you guys to be in the best health possible. So this is just something that we highly recommend that you really push for, especially if you've been a frequent smoker, because even right now it still is beneficial just to even start on it so that you get the most out of your life. So. But besides that, that's actually all the time that we have for you guys today. So we appreciate it. If you have any questions about anything that was covered right now, we highly recommend talking to your healthcare provider, whether that's your pharmacist or physician. And until next time, thank you guys so much for stopping by and watching.